My name is Jeremy Haas. I'm an athletic trainer with Select Physical Therapy. I got my Bachelor's of Science at Illinois State University in athletic training and my Master's of Science at Illinois State University in kinesiology. Select Physical Therapy is the largest provider of athletic trainers and physical therapists in the country. I work as the area sports medicine coordinator, where I coordinate all of the athletic training services in Las Vegas, along with my partner. I also work as the head athletic trainer at Extreme Couture MMA. I got involved with athletic training because I played a lot of sports in high school and college and seemed to always be getting hurt, so I spent a lot of time working with athletic trainers and physical therapists, and it was just something that interested me. I also teach a couple classes over at UNLV for their athletic training program over there, and then I work as a preceptor. So all athletic training students not only have to do the class work, but they also have to get experience out in the field with different athletic trainers. And since I work with pro fighters, and it's such a unique opportunity, all the juniors in the program come through me and do a 2-week rotation with me. The 2-week experience they get with me at Extreme Couture is unique because there's not a lot of athletic trainers working in MMA. So they get to see kind of how a pro fighting practice is conducted, and then we get to do a lot of treatments that they wouldn't normally see at the college level or at the high school level. Everything from treatment to assessment to different modalities that we can use, such as ultrasound and electric stim and some of the manual modalities that I use as well. A typical day at Extreme Couture, before practice I get the guys ready by taping them up or taking care of any injuries they may have. And then I'm there during practice to take care of any acute injuries, any fractures, dislocations, ankle sprains, anything like that. Then after practice I stick around for about an hour after practice and do treatments on anybody who has injuries or has had a surgery recently or anything like that. Just basically do the rehab for them over there. I guess my greatest moment as an athletic trainer was when I was working with, a soccer event. There was a tournament, got called to a field, got to there, the 16-year-old soccer player was unconscious, not breathing, and no pulse. And I was able to begin CPR, and then with the help of the EMTs, when they got there, we were able to revive this kid, and he's still playing soccer to this day. I've seen a lot of bad injuries, everything from spinal injuries to the CPR incident I told you about, to complete dislocations of the knee, shoulders, everything like that. But I would say probably the worst injury, the most traumatic, was probably the neck injury that I had. The kid was, they told me he was never going to walk again, and he went through an extensive rehab and was able to get back, and he was able to walk at graduation. I also recommend that all athletic trainers try and keep up with the current research. One of the problems I see with a lot of athletic trainers is that they pass their certification test, they get their state license, and then they become complacent. They don't continue to grow and continue to self-educate themselves. And that's important in the medical field and really any field, to stay on top of the current research to make sure that you're doing things exactly the best way you can to help your athletes return faster. Some of the modalities that I have available to me over at Extreme Couture are ultrasound, electric stim. I have some instrument-assisted stuff that I use for soft tissue mobilization, and I have a cupping set, and then just lots of other modalities and stuff that you have with professional sports that you can use on adult athletes that you can't necessarily use at the high school setting or even at some college settings. One of the biggest issues that's plaguing athletics, especially MMA, is head injuries and concussions. And that's why it's important to stay on top of current research, because we're finding out so much more about what a concussion entails and what its symptoms may or may not mean. From everything from the cognitive side to the signs and symptoms to the vestibular side that we're starting to do a lot more research on now. We use a bunch of different tests to assess concussions, such as the SCAT-3, and then we're also going to start implementing a C3 logic, which is going to help us determine the vestibular component. So a typical injury, like hypothetically, if someone was to break an ankle or something on the mat, what we would do is we would run out there, we would take care of obviously any emergency stuff that we would need to, we'd contact EMS, and then just stabilize the injury until the EMS get there. Sometimes that involves splinting, sometimes it may involve a reduction of a dislocation or whatever the case may be.